What I want to do today is just talk about the who, the why, how we're addressing the problem of the uninsured, and kind of what the future looks like. So I'll try to do that in a half an hour. Is that about what I have? Okay. So why are we even here talking about this? It really hit home to me years and years ago when I was in Atlanta. I was working at Grady Hospital. Grady Hospital is a big public hospital in Atlanta, and most of my patients were indigent and uninsured. And we went, I leapt from that world one day to another world, going to a cocktail party with a very affluent group of people. And somebody asked me what I did. I said, I'm a nurse practitioner. I work in a Grady clinic. And she said, who do you see? And I said, mostly people who don't have health insurance. And she said, are there really people who don't have insurance? And I really became aware of the fact that this is a very silent population. They don't have the ability to advocate for themselves. Nobody really knows they're there, but they are there. And I also became aware of a couple of the myths as time's gone on. And one of the myths is people say, and somebody said this in one of our tours the other night, well, they can go to the emergency room. Well, you can go to the emergency room. By law, an emergency room has to screen you and stabilize you. But they don't have to treat whatever's going on a long-term basis. So we frequently have patients come in who have been to the emergency room because they had an accident. They have a broken arm. The emergency room stabilizes the fracture, puts a splint on it, and says, go see your orthopedist tomorrow. Well, if you don't have insurance, you're not going to see an orthopedist. Or you go to the emergency room because you have a dental abscess. And we see this even more frequently. If you go to the emergency room with a dental abscess, they will give you an antibiotic. No, they will give you a prescription for an antibiotic. They will give you a prescription for a pain med, and they will tell you, see your dentist tomorrow. If you don't have a dentist, if you don't have money to pay for a dentist, you're not going to see a dentist. And just as bad, if you don't have money for the antibiotic and the pain medicine, you're really up the creek. So yes, emergency rooms will see people, but it's not an adequate solution. And then the other myth that we have is that Medicaid takes care of poor people. In Virginia, if you are a single adult, you cannot get Medicaid. We're like fourth from the bottom of the number of people who are eligible for Medicaid because our eligibility is so strict. So I don't know if everybody knows what the federal poverty level is. It's what the federal government says is poor. So for a single person, it's about $12,000 a year. If you could get Medicaid in Virginia, you would only be able to make $9.31 a day before, if you made more than that, you would not be eligible for Medicaid. That's how strict Virginia is. But as I said, if you're a single adult, you don't qualify anyway unless you have a specific condition like kidney failure or pregnancy. So Medicaid, what I'm trying to say, is not a solution, especially in Virginia. So that's why this is a problem. So who are the people who are uninsured? Mostly they are people who are low income. If you look at the number of uninsured, the majority are very low income. Most of them work. That's another misconception, that these people just don't want to work. They don't want to support themselves. Most of our clients work. Unfortunately, they work at jobs where it's part-time. They're not offered insurance. If they're offered insurance, it's such a big chunk out of their income that they can't afford to buy it. So it'll be up 10% and up of their income. And if you're making minimum wage, that's not sustainable. So in Virginia, we have, there's about a almost 17% chance, if you live in Virginia, that you do not have health insurance. Pretty good chunk of people. It's about 1 million people in Virginia, and in the United States, it's 48 million. And you've probably heard that number because there's been so much talk about it with the Affordable Care Act. But those are the numbers. About 40% of those people live under the federal poverty level. So if I said it was $12,000 a year as a single person, that sort of gives you some kind of perspective on that. And a disproportionate number of the people who are insured are minorities. So about 40% of the people who are uninsured are Black. And I should say, Blacks have about a 2 times greater chance of being uninsured. Hispanics have about a 3 times greater chance of being uninsured. I talked about why there's so many. The other reason why there's so many people who are uninsured is because of the recession. In our organization, between 2007, 2008, and 2009-10, we saw a 45% increase in the demand for our services. That was when the bottom dropped out of the economy. And you know, the unemployment has not really bounced back the way we thought it would. I don't know if everybody heard this month's statistics. They thought it was going to be twice as good as it is, and it really was not as pretty a picture as they'd hoped it would be. So what difference does it make? What's the big deal about being uninsured? What happens to you when you're uninsured? You get less preventive care. Most people who are uninsured are not going to be able to spend the money to go get a mammogram or get a colonoscopy. And the statistics are all over half, over 2/3 of the people who don't have insurance don't receive those services. So if you don't get those preventive services, what happens to you? When you are diagnosed, you're diagnosed late. So if you're diagnosed with breast cancer because you didn't get a mammogram and you waited until that mass became obvious to you, until you felt something, you have a 50% greater chance of dying from breast cancer. If you don't get colonoscopies and you wait until you have symptoms, you have bleeding or whatever, again, you have a 50% greater chance of dying from your colon cancer. So the repercussions are great. You don't have a source of health care when you get sick. So you really don't have anybody to go to. So who do you go to? You don't. You just hope you get better, or you go to the emergency room, and that's not a good use of our emergency rooms. If you get sick when you don't have insurance, you probably have a job that doesn't pay you to be sick. So you know that if you don't go to work, you're losing income. And we have this happen with our patients all the time. They need a knee replacement. We're able to figure out how to get that to happen, and they say, I can't do it. I can't be out of work for 4 weeks. That's my income. That's what I live in. I have no buffer. I have no savings. I'm living day to day. You're more likely to be hospitalized for avoidable conditions. So if you have somebody who comes in and they get their diabetes treated and they do pretty well, their hemoglobin A1C is good, they're avoiding getting renal failure, they're avoiding getting foot complications, that's great. But if you don't get treated, you end up with those complications. And by the time you go to the hospital, you've got the renal failure, you've got the congestive failure, whatever result of a chronic problem that you already have. And again, you're more likely to die from those conditions. And the other thing I think is really interesting is, and I'm not really sure how this works, but if you end up in the hospital, you're less likely to get the diagnostic tests that you get when you're insured. Maybe that's just a purely economic thing. The hospital's seeing that this is a source, I don't know. And you're less likely to get the therapeutic interventions that you need. So people who go to the hospital without insurance because they're in a car accident or they have an MI are not going to get treated the same, and they are more likely to die. People, and the financial repercussions are, of course, huge for people who don't have insurance. Medical bills are involved in about 50% of personal bankruptcy cases. And when they go to the hospital, they are going to pay more, even if they can pay, because insurance companies have worked out arrangements with hospitals about how much things will cost. But if you go in and you're self-pay, you're going to pay the full price. So the cost of their care is actually greater too, which is even, makes more of a problem for them as far as being able to afford their care. And then we pay for it. So they're not the only ones suffering financially. We pay for it because the hospitals charge more for everything because they're trying to cover the cost of the indigent care that they provide. We pay more in taxes because we pay some of the cost of that indigent care through our taxes. and we pay more for our insurance premiums. So this is something that everybody in society bears the cost of. So who takes care of the uninsured? And I think this is really why I'm here, but I wanted to give you just sort of a baseline for this. If you're uninsured in Virginia and most states, there are several resources. I said the emergency room, which we don't really think is a good resource unless you really need an emergency room. There are public hospitals like MCV and UVA who do a huge amount of indigent care. They're hard to get into, they have waiting lists, it's not easy, but you can qualify, and their qualifying income is very low. And then there are federally qualified health centers, and they are federally supported, and they work on a sliding scale. So they are an option, but our experience is that our patients can't always even afford that, because even if they qualify for the low-cost visit, the labs and the meds aren't necessarily covered, and specialists. So that's only, again, a sort of partial solution. There are a lot of, probably 6 FQHCs, that's the short name for them, in the Richmond area, and then there's one in Cumberland, one in Farmville, one in Louisa. We don't have one close to Goochland. And then the other option for people are free clinics, and that's really what I'm here to talk about. Free clinics came about as a response to the high number of uninsured people and the fact that Medicaid was not taking care of this group of low-income uninsured people. They are everywhere, and if you look at the density of free clinics in different states, the states that have very strict Medicaid requirements are the ones who have the most free clinics. And as I said, Virginia is one of those. We have 58 free clinics in Virginia. And that sounds like a lot, but that only covers half the localities in Virginia. So some of those localities also have an FQHC that takes care of people, and maybe that's why a free clinic didn't come about in that community, and then some just still have any care at all. All the free clinics are different. The saying in the free clinic world is, if you've seen one free clinic, you've seen one free clinic. Because they're all different, and they all have come out of their community. So they have been customized, been tailored to meet the needs of that community. So for instance, if that community has a FQHC, maybe that free clinic won't duplicate some of the things that FQHC does. If they don't, they tend to have a wider spectrum of services. Last year, the free clinics in Virginia saw almost 80,000 different patients. But when you think about that 1 million people who are uninsured in Virginia, that doesn't take care of everybody. Most of the free clinics are privately funded. We don't get federal funds. That's what makes us different than a FQHC. We get a little bit of state funding in Virginia, and the concern is that funding will go away as the Medicaid expansion, which looks like it's going to happen in Virginia, last I heard, as that comes into play, the legislature will say, well, we've got Medicaid expansion now, we don't need free clinics. So that's one of the concerns the free clinics have about their funding. And most of the free clinics are volunteer-based and have an infrastructure of staff who support the volunteer efforts. So that's sort of a generalization about free clinics. We're all members of the Virginia Association of Free Clinics, and they help support our work. So in Richmond, I'm drilling down here now. In Richmond, we have about 5 free clinics. Has everybody heard of Crossover Ministries? Crossover is the biggest. Crossover has 4 different sites. They have their Cowarden location south of the city, and they also, I don't know if you know, because they don't have a sign in front, have a fairly big clinic now right across from Regency Mall. Right by Toys R Us, they're not allowed to put a sign outside, which makes it really hard when you're trying to tell people how to get there. We work very closely with Crossover to leverage services. We've established, for example, a vision clinic at that West End Regency Mall area clinic because they had the equipment and we had some volunteers. We don't have space, and so now we've set up a clinic that's funded by the Richmond Eye and Ear Foundation, that all the free clinic patients can come to that location to get vision care. We didn't have that before. People, if they were truck drivers, and we had this happen several times, needed a vision exam just to make sure that they could see, or needed correction, we had no way of getting that for people unless they could save up the money and go to Walmart or whatever. There's Fan Free Clinic, and that's on Thompson Street, sort of right as you, near the Science Museum. There's the High Blood Pressure Center down in Carytown. Hanover has kind of a hodgepodge of interfaith network clinics, started by, interestingly enough, by a doctor who's also a dentist, and his wife who's a nurse, and they have several clinics that they run around the Hanover area. And then Powhatan has a free clinic, and that's a very small clinic that they started about 5 years ago, and they do primarily medical. Then we have the Goochland Free Clinic and Family Services. And again, probably most of you know, but the Goochland Free Clinic came out of this church. It was the outreach committee that came up with the idea of maybe we need a free clinic in Goochland. There are people out in Goochland who are uninsured and not having their needs met. So they sent out a little letter to the congregation and said, who's interested? And 5 people responded and worked for about 1.5 years to see if this was feasible, work with the community, get people involved and committed, and look at the need. And we opened the clinic in 2000. And we opened in the basement of the health department in a space probably not as big as this oriental rug right here. We were pretty cramped. John was involved, and Lisa Bagby was involved, Bob Bennett was involved, Tom Frank was involved. So it was really a great St. Mary's effort. It's just awesome. And then probably within about 3 years, we were able to move the clinic into the administration building because they were renovating that old high school and offered us space. Very, very generous of Goochland County to give us that space and to really configure that space the way we needed it, to put in 4 dental chairs, which we raised the money for, but they did all the plumbing and everything, and that's very expensive. So we moved in 2005, is that right, Brenda? 2005? And we were doing pretty well. We were sort of going along, and one evening, Wayne Dementi, who was with the Goochland Fellowship and Family Services, called me up and said, Sally, this is Wayne. He said, you know, we're dealing with some things over at the Fellowship, and we want to talk to y'all. We figure we can either nix it, just dissolve the nonprofit, or we can fix it. We can go back to what we were doing before, but that didn't seem to be working real well at that point. Or we can mix it, and we want to talk to you about mixing it. So we talked. Jack was involved in that, and Wally, and we had great leadership for that. And the 2 boards, again, spent about 1 year looking at all the issues that it would take to merge 2 nonprofits. Always at the center of the table were the clients. And that kept all the ego out of it. And in 2007, end of 2007, we merged the Free Clinic of Goochland with the Goochland Fellowship and Family Services. We're still called Fellowship a lot. And became one organization. And again, keeping that client in the middle of the table, we knew this was the right thing to do for Goochland. We knew that it was going to make it easier for the clients to access services, to find out about us. It would make it easier to fundraise. People wouldn't be pulled between 2 different organizations. It was more efficient. So we've worked very, very hard on that. And I'm going to tell you a story about kind of what's evolved. I was in the clinic one day, and I was changing a patient, a lady we'd been seeing for years, literally years. She had had abdominal surgery and had an infection. And she needed dressing changes when she was discharged twice a day, and we could only find a home health group that would do it once a day. And they were doing it, again, you know, out of the whatever generosity of their hearts, but they could only do it once a day. So we said, well, come to us and we'll do it once a day, and they can do it once a day. So she's laying on the table. This is about the 3rd or 4th day she'd been there. And I was changing her dressing, and she said, Miss Graham, can I tell you something? I said, sure. She said, I just want to tell you that I know I had the same pair of underpants on yesterday that I've got on today, but I want you to know they're clean. I wash them every night. I only have one pair of underpants. We had known this lady for years. We had no idea she was living in the condition she was living in. Well, that's changed now. Now that we have this full spectrum of services that includes food, clothing, medical transportation, GED literacy, financial assistance, housing repair, indoor plumbing repair, medical, mental health, dental. We no longer say to somebody when they come in to register, just what's your name, what's your address? We say, what's your name, what's your address? And then we say, you're here for dental, but let me ask you something. Do you have enough food to eat? Do you have a safe place to live? Do you have clothing to wear to work, to send your kids to school? We have a whole basic needs assessment that we do on every client who comes through. And we have really expanded our definition of health to be not just, here's a prescription, go get your medication filled, but to be the definition of you can't be healthy if you're hungry, you can't be healthy if you're cold, can't be healthy if you don't have your dental needs addressed. So we are really, that's where this organization has gone, and it is very unique in the free clinic world, and I think in the nonprofit world. And we're very, very fortunate to be able to do it, and we can do it because we have such a strong volunteer base. And as I said, so many of you are sitting here who have been involved with this. And we have such support from the community, including the faith community, especially St. Mary's. So I will stop talking. It's probably time for me to stop talking because I want to give time for questions and comments. And Sidna, do you have anything to say? Sidna's one of our key volunteers in the food pantry. No, again, we couldn't do it without the volunteers.
What's going to happen, Sally, with this proposed health
Oh, I got off script. Thank you. That's here, actually. What will happen with Medicaid expansion? Yeah. For the states who are participating in the expansion, and that's not all settled yet, eligibility will go in Virginia from being 23 to 30%, depending on your situation, to 138% of the federal poverty level. So it's a huge expansion of eligibility, and you won't have to have specific conditions to qualify. So that means that for a family of 3, that's about $35,000 a year. So that's the people from 0 to 138. For people from 100, but from 139 to 400, they will be eligible to participate in the exchanges. And they will be eligible for subsidies that will sort of underwrite the cost of the premiums and the copays and the extra things. So that's what's supposed to happen with the expansion. A couple things are holding it up in Virginia. If you've been following the news at all, McDonald's gone back and forth with it. The legislature's sort of gone back and forth with him. He actually, in order to get his transportation thing through, offered out the Medicaid expansion because it didn't look like it was going to happen until they wanted to use that as a bargaining thing between the Democrats and the Republicans. But it does look like it's going to happen now. Probably won't happen in Virginia until at least July 2014. So for free clinics and for the uninsured, that means about 2/3, half to 2/3, depending on where you are, of patients by income will be eligible. We know, though, that there will still be a significant number of people who don't qualify. And those are undocumented, people who are here and don't have the documentation, people who decide, you know what, it's still going to cost me to be involved in an exchange. I don't have the money. I'm not going to do it. People who are offered insurance through their employer because employers have more pressure now on them to provide insurance, who again say, too much of my income, I can't do it. And then, I'm trying to think of, and then people who are between coverage. So even if it goes into effect in July, it's going to take a long time for people who are absolutely right in line for Medicaid to get that application in, and then for social services who are not getting any increase in staff to process all of those applications. So that's who's going to be left. We know that, again, remember I said there were about 80,000 people served by free clinics out of the 1 million. We know we're still going to be in business. We know there's still going to be people who need us. And we also know that this will not cover dental. So dental is as big a need as it ever was. Medicaid and Medicare have never covered dental. So we've always had more of a demand for dental than medical. So we know it's not going to cover dental. And our concern, quite honestly, as I said before, is that people will now say, well, we've got this expansion. Why do we need a free clinic? I don't need to support this organization. So it's going to take a lot of education on our part. And fortunately, because we do so many other services, we're in a good place. The free clinics that only provide medical are really, really nervous about this. So thank you for asking the question. Get me back on track. Now, are there any questions?
What looks like help from us?
Sorry?
What looks like help from us?
Well, interesting you should ask. We are just moving into looking at our space. Our space is inadequate for our clothes closet, our food pantry, and Sidna saying amen. Our food pantry's in the basement, and Joni, and it has stairs that people, it's just not in a good place. And then depending on how we decide to respond to the Medicaid expansion, we know we need more space. So we will definitely be talking, getting people at St. Mary's involved. Wally's already spent some time talking to me about it, and I hope to get a couple of the people at St. Mary's who are involved in construction, involved in that sort of planning, trying to figure out what we need first, and then trying to raise the money for it. We're looking for an architect, if anybody knows anybody who might be interested in helping us. And then always, St. Mary's does a great job with food drives, so when those blue bags come out, fill them up. Food is never ending. It's not like you fill the food pantry up and you go, oh, good, we're good for the month. You fill the food pantry up, Thursday morning comes, and Thursday afternoon it's empty again. Yeah. So food is, it feels like we're always asking for food, but we're always asking for food because guess what? People need to eat, always. So food's huge. We have a closet in the back building back there that you can bring things to donate to the clothes closet. So we always need clothes, household items, linens, especially things like men's clothes. We don't get as many of those as women's clothes. Not a big surprise. And even things like underwear, bras, and things like that, we can always use those. And we come and pick up from here. We've had a bit of a dent in our donations from Goodwill up at Centerville. So we're trying to be a little more, get the word out a little bit more, that if you donate to our clothes closet, it stays in our community. It goes to people who need it. It doesn't get sent overseas. It stays right here. So that's very much appreciated.
Where is the place you leave the stuff?
Back in the Sunday school building back there at the end.
It's behind, where what they call an 8th grade classroom is? There's a little door.
It's always open?
The very end of the building.
The
Always
door
open
is open to that room
for clothes and
for clothes, bags of anything.
food? Not food.
I'll do a personal pickup, Jane.
I'm gonna come see you.
Okay.
So how are you doing financially now?
December comes around, you're like, how's it going to look? We are about 7 months forward funded. So we are in good shape. We've had very good fiscal management. We've got a great finance committee. We're always looking at, where we are and what we need to do. We have a fundraising system that's worked very well for us. How many people have been to our breakfast? Anybody? Cool, good. So what we do is we try to go into the community and educate people about our work, and don't at all those little groups or whatever ask for money, but it sort of culminates in our breakfast where we do tell people this is a fundraiser and we do ask for a pledge. And so pledging is one of the ways people really can help, because then we know what's coming in. It's a sustainable fundraising model. And we have, a number of people who are in our Caring Legacy Society, and that's people who have pledged $1,000 a year or more. And that's been a huge, huge help. Another way you can help is if you're involved with a book club or with just a neighborhood group or whatever, we're happy to come and speak. Obviously, I love talking about this, and I'd love to come and just tell people what we're doing. We are just trying to educate the community, not just for fundraising, but because you never know when you're going to run into somebody who needs our services, and you need to know what they are. Because we are the safety net in Goochland. This is it. This is not a community that has 50 nonprofits. We're it. And so I know that I've had people come into the house to do work like painters and stuff, and we chat, and I'm like, so you're working for yourself? Well, what are you doing about insurance? I don't have insurance. Did you know? And, I've done this at Macy's, all over the place, but first you got to know about it. Did that answer the question?
I have a question.
Yes.
What kind of response do you get or not get from the Richmond Academy's Access Now initiative with their position?
And I didn't really go through all the services that we provide at the clinic. We make sure everybody gets their medications. We make sure everybody gets their diagnostic tests. That's HCA and Bon Secours helping us. And then we make sure people can get to a specialist. And that's through Access Now. That's the Richmond Academy of Medicine's effort to take all the specialists who independently we used to all keep our separate lists. It was probably the only thing in the free clinic world that we didn't share with each other. I would not tell crossover who my orthopedist was, But Access Now took all the generous specialists, put them in a big pool. We send a referral down to Access Now for an orthopedist or dermatologist or whatever, and they make the appointment with the group. And it's wonderful. Absolutely wonderful. There are a couple specialties that don't participate, which is difficult, but for the most part, it is wonderful. Yes, absolutely. Thanks. Yeah.
Sally, update me on the emergency housing, the little apartment behind the fellowship.
Oh, okay. So,
Is that still functioning?
oh yeah, absolutely. So one thing I didn't mention is that we have 2 apartments. They're behind Family Services, and it used to be a garage, and St. Mary's, once again, stepped up and renovated one of those apartments, actually made it into an apartment. And Bird Church out in Western Goochland did the other one. And that is, they're used for people who would otherwise be homeless. So they've been evicted, they've been burned out of their house. Sometimes we use them to put people in when we are in the indoor plumbing rehab program. We're actually building them a new house, so we put them in there while we're fixing up their new house. There are 2 of them. It's the only emergency housing in Goochland. And if you think about Goochland, if you know anything about Goochland, there's not even a hotel in Goochland. And there's no low-income housing, and there's no temporary housing. So really those apartments are pretty much it. And as soon as somebody goes into one of those apartments, they're hooked up with our case manager. So they don't just get housing, they get case management, looking at, where they're going to go from here, what kinds of other needs they have. We've gotten people into things like St. Joseph's Villas, Hilliard House, things that can help them move forward. So, yeah, thanks.
Is the percentage of poverty in Goochland higher than the other counties comparable?
Depends on the county. It's lower than Richmond. It's about the same as Powhatan. It's about 7%. But again, federal poverty level is really low income. We see people up to twice that much. So if the feds say it's $12,000 a year, we see people up to 24, because we know that at 200% of poverty, you still can't make it. And that's really one of the things that makes us needed, because social services, the state program, is again very strict on their income guidelines. So we pick up the people who they can't help because they make $2 over what it takes to get food stamps, or they're just a little bit over. Yeah. And we work very closely with social services. Goochland's a great place, not just the partnerships we have with the faith community, but the partnerships we have with social services. Frequently, if we have a client in crisis, social services and my staff is working together to figure out how can we combine resources, how can we figure out together what we're going to do for this person. So it's just a great community.